My name is Kags. I work for the Open Institute, which is based in Nairobi, Kenya. And we are primarily a Kenyan organization, but that works in the rest of Africa as well. A lot of our work involves two major themes. Theme number one is promoting responsive government. So getting governments to be transparent, getting them to listen and to build the infrastructure that they need so that they can better listen to the public. And then on the other hand is we work with, I want to say, citizen groups and civil society organization and others to try and get them to be as active as possible. So we promote active citizenship as the other theme of our work.
How has COVID-19 affected Open Institute, your work, both operationally, but also programmatically?
We got involved with government and asked, how can we help? The government has something called a National Emergency Response Center that was immediately activated by the pandemic. And that is sitting at the Ministry of Health and the Presidency. So we immediately went to them and said, guys, what do we do? How can we help? And we have been involved in helping them with different things, with helping them with setting up some of their technological tools that they quickly need to be able to get going and to be able to sort of pass information to the public. We have been involved in supporting a couple of campaigns to let the public know what they need to do, what they're supposed to be doing with regard to protecting themselves against COVID. But then more recently, we learned from talking to government and from other civil society organizations. Oh, that's the other thing that we did, is that we started bringing together, because a lot of organizations kind of were all lost. They sort of closed down, went to working from home mode, but kind of didn't know what to do. And there was no one talking to anybody else. No other organizations were talking to other organizations. So there was no cross-learning. There was no helping each other out, that sort of thing. So we started, at least in the month of March and April, to have this online calls where we were just bringing together different organizations saying, so how are you guys doing and how are we doing and what do you think we should do now in this situation? And different people had started to have different ideas. One of those ideas that came up, especially from the government and from the civil society organizations, was that there is no way of monitoring citizens, how COVID is impacting citizens beyond the health aspects. So we built Nuru as a tool for community monitoring, essentially. And we hope that even you guys, wherever you are, I'm not sure which countries, which states you are in, but I would love to see that you guys also download Nuru in your own Android or iOS apps and start using it wherever you are. And the idea behind it is very simple, that as you're walking around, you're observing what is happening within your neighborhoods. Are people wearing masks? Do you guys have access to water? Is there a challenge with electricity now that people are working from home? Are there challenges with the internet? Like in the middle of the day, in my country, in the middle of the day, everybody is having video calls, and therefore internet has lots of troubles. Whatever it is that you see, are people congregating in a place? Are you going to a place where they're taking less precautions? Like, have you gone to a shop and it turns out that they're taking less precautions than another one? Or have you gone to a shop that is extraordinary in terms of how they're taking precautions? Eventually, what the goal is that eventually people are going to be able to look at Nuru and they will have anecdotal evidence of where people had massive problems, how this pandemic impacted people in different ways, human rights, etc. And so then there will be, I'm sure we will all learn from that experience in some way and prepare better for any future pandemics, or at least prepare better for the apocalypse when it finally comes.
Throughout these conversations with grantee organizations, one of the themes that has come across is the importance of government transparency in accurately reporting COVID case counts, death counts, hospitalization rates, hospital capacity rates. And when that type of information is not shared publicly and consistently, then it can lead to a lot of rumors on WhatsApp or misinformation about what's actually taking place. At the same time, it seems like governments are now trying to collect more information about citizens than ever in order to understand where they are, where outbreaks are erupting. And there are a lot of concerns about some of these new apps that track our location or track who we've come across through cell phones. I know that this is an issue that Open Institute has become more involved in striking this balance between the beneficial effects of transparency and some of the dangers of surveillance and how that information is used. So can you describe how your thinking has evolved and what sort of advocacy you're doing during the COVID pandemic?
Our position is that transparency is, at this time, even more crucial than ever before. I come from a marketing background, and one of the things that you learn in Communication 101 is that during any crisis, over-communicate. The more communication there is, the better it is, because it helps everybody to manage their expectations. So we've seen quite a number of countries here in Africa doing a really great job of communicating. Our own country is doing a daily update every single day at 3 p.m. The minister or somebody from the Ministry of Health comes on TV and updates people on this is what is happening. These are the kind of people who have contracted. These are the numbers, and these are the kind of people who have contracted. These are how many have recovered. And these are how many that have died. So I think this is a really important thing in terms of just that level of transparency. But what has then happened is that the governments are starting to take some liberties with regard to people's data by looking for information from using the mobile phone to find information about who I was with, which is great in terms of pandemic because of the fact that it has helped. Certainly, I've seen it here in Kenya that it has helped to a very large extent in terms of making sure that people are not, the disease is not spreading as fast as it could have been. However, there now is evidence of overreach in government, where a number of challenges exist. One is that after the pandemic, we don't want them to still do contact tracing, still have the capability for contact tracing without being checked. So what we have done is that we've partnered with Amnesty International and a couple of other organizations to begin to build that advocacy and to try and wind that down. But in addition to that, we are working with a UK organization called Data Ready to sort of convene conversations across the continent, from Southern Africa to Western Africa to Francophone Africa and so on, to get them to also have a joint position, but to begin to engage with the African Union and the UN, so that there is a sort of pressure from the top in terms of the UN and pressure from the bottom in terms of the citizens to actually get governments to do the right thing with regard to having a policy that winds down the intrusive nature of data usage.
I've had the pleasure of seeing you here in the United States when you came to visit, and I've seen you in Kenya when I went over there to visit. What do you see as similarities between Kenyan and American societies, and what do you think we can learn from each other?
First of all, my sympathies to Americans, because I think that you guys are having a terrible time. I'm seeing that the COVID numbers are going up very, very fast, and I am also seeing that the policies around COVID are quite terrible. It's a terrifying time to be an American, I think, right now. I do think that there are a number of things that are similar. It's similar in the sense of police brutality is an issue that is facing both a lot of Africa right now and America. Between America and Kenya or America and Africa, there's a significant amount of disenfranchisement of particular sections of population, especially the poorer ones. It just works out that in America, a big chunk of that are people of color that are poorer than in other places. But you'll find that here, even where everybody is Black, disenfranchisement is happening in very serious ways of poor people. And I think that the opportunities that exist in terms of us completely changing the direction or changing the attitudes of government, both in America and in Kenya, in terms of how we deal with poor people and how we set up laws that protect poor people predominantly, and how we change how capitalism is done on the continent, I mean, globally. If there was one thing that I would say on this subject is that we must together take advantage of the opportunity that COVID has presented us to jumpstart capitalism, to make sure that it is a little more equal, a little more equitable, a little more fair to people. Because obviously capitalism is how we will continue to develop, but we can't continue the way we are. It's too visceral right now.